Hello. Um, you all know me. I'm Samantha McCoskey, graduate nursing department. This is for the transition to advanced practice class, and I am doing my presentation on important considerations when practicing via telehealth, on call, and telephone triage. So, just some of the things that we'll go over is the introduction. We'll go over the telehealth platform, the telephone triage platform, and the practicing on call platform. So, there are multiple disciplines that provide health services on different platforms for not only medical doctors, um, anesthesiologists, nurses, but for us, advanced practice providers or nurse practitioners. Um, Today, we will be talking about two virtual health services as well as the on-call service, along with items to take into consideration when using each type of discipline in your practice. First, we'll talk about telehealth. So, telehealth has expanded over the past decades. It's experienced significant growth during and since, honestly, the COVID-19 public health emergency. Coordinating care has improved due to the advancement and role of technology. So, telehealth is defined as the use of electronic information and telecommunication technologies to support long distance clinical health care, patient and professional health related education, health administration, and public health. Telehealth is when a patient receives care at one site from a specialist working at another site in a traditional model, and they are not face to face or person or in person in the same room with their patient. So, some important considerations using telehealth in your practice are really to kind of dive into what types of technologies make up telehealth and what type of technology you would like to use in your practice. So, you could use the internet, video conferencing, store and forward imaging, streaming media, land and wireless communications. Some other things to take into consideration is your telephone etiquette. There are techniques for completing a telehealth visit. Before a telehealth visit via telephone or video, you need to establish a Health Insurance Portability and Accountability Act compliant environment, or otherwise known as HIPAA, by providing privacy in an examination room or private office. This also eliminates distractions such as office noises and personnel walking in the background. So you want to be in a place where it can just be you and the patient with whichever type of technology you choose to use. Um, the provider needs to make others in the office aware of the upcoming telehealth visit by placing like a telehealth visit in progress sign on the door or just something that is indicative of what is going on so that there's no um, distractions or interruptions during your visit. You also need to take into consideration the equipment that is going to be needed for this type of platform. So, when preparing for the telehealth visit, it's essential to check the equipment, practice the visit, know how the equipment works, and troubleshoot common problems. These preparatory measures will help the encounter proceed smoothly and relieve both the providers and the patient's anxiety. Um, Make sure you check your camera placement, background, practice a visit as a patient, learn how to troubleshoot the system from a patient's perspective. Um, Credentialing and legislation for the provider for telehealth implementation into practice can be difficult due to the rules and regulations over patient provider encounters and state laws over advanced practice providers practice. So while you hold the national certification, you can only treat patients in the state where you obtain your licensure as that advanced practice provider. Um, financial consideration for telehealth. So the reimbursement part is really typically at a lower rate than a video visit. Like telephone visits are a lower rate than a video visit. So just really you need to or not concentrate, but you need to check into what the reimbursement and financial considerations are for virtual telehealth visits, to see if it's going to be beneficial for you to offer these. Maybe just situational, if it's more of like a COVID type situation, or if it's something you're going to offer more to anyone for convenience, or something like that. You should check into the financial considerations on reimbursement for your practice. um, One of the big considerations you really need to check into is the HIPAA guidelines. So you can find all of that online. I won't dive into that completely because we all know what HIPAA is, and we all know that it's like one of the most important things in healthcare. So that just to know that that is the big one of the big considerations when choosing, not only if you use telehealth but any type of platform in your practice. And then so you can, with the benefits of doing telehealth is, so you can provide this to patients who have difficulty traveling, or who may be like kind of isolated, to where like if they where they're located and they just can't get out easily, or if you have bedbound patients that don't travel easily, or patients that have to use lifts or things like that. The telehealth visit is a good option for those types of patients, so that they can keep up on their health and have timely visits, and get their medications refilled and things like that when a visit is required. So, the biggest barrier to telehealth, obviously, no physical exam. You are not going to be able to, although you can see your patient face to face, you are not face to face with your patient physically. So you are not able to put your hands, to do an exam on that patient. You're not able to put your stethoscope to their chest. You're not able to look in their ears. You're not able to do those types of things. So that is probably one of the biggest barriers to a telehealth platform. And then, of course, not using a HIPAA compliant exam room. Um, like we said earlier, you need to place a sign on the wall. You need to be in uh, a place where it's just you and the patient, and there's nobody else around that can hear the visit, see the visit, things like that. So the next discipline or platform we can discuss is the telephone triage. Typically, this is done by a nurse in the office. Sometimes can be done by the advanced practice provider or even physician, but it's a triage in a practice in healthcare where nurses assess and prioritize patient needs over the phone. So what this does, by doing this, the patient's concerns are being assessed for the onset, duration, severity, relevant associated signs, symptoms, and history of the problem, all over the phone. Again, you won't be actually putting eyes on the patient or hands on the patient. So you need to be able to use your listening and picking up on keywords that they're saying to help determine the appropriate level of care. This does involve critical thinking and assessment skills. um, the person conducting the triage will use physician driven protocols to manage these calls. So, what that means is the patient will tell the provider on the phone or the nurse on the phone what is going on, the symptoms they're having. They'll go through a series of questions based on what these patients are telling them, and then they will decide at that point from the physician driven protocols what the level of care needs to be, whether that be going to the ER, whether that be being seen in an urgent care or a walk in clinic of some type, being seen in the office if it's during office hours, or if it's just some home care advice that needs to be given, some things that they can do at home, and what to watch for as far as signs and symptoms worsening or new things happening and when to call back, types of things. Um, this can also happen in various types of settings. Typically, two different settings. It would be a remote position from home where the provider, advanced practice provider, nurse is set up remotely at home to take these calls, or in an office setting during the office. And then, of course, after hours, there's typically always a telephone triage team that takes those calls after hours when patients are experiencing symptoms and need to walk through that with a provider. So, important considerations using telephone triage with your practice. So, when you implement this in a practice, several considerations are essential to ensure the quality and safety of the care that's provided. So, training and certification, first off, nurses, advanced practice providers should be trained and certified to provide appropriate care advice and follow the established protocols that are physician driven and written. The regulatory compliance, nurses must adhere to federal, state, and institutional regulations, including the Code of Ethics and practice standards, and to ensure safe and effective telephone triage. The documentation piece of this is required for telephone based encounters to maintain accurate records and accountability. The risk management portion. So the telephone triage involves risks such as providing inappropriate advice or failing to perform triage due to lack of visual cues. So that's where your sense of hearing really needs to be on point, where you're picking up on keywords that they're saying that would prompt you to ask other questions based on the symptoms that they're giving you. And then patient education, of course. Nurses should educate patients about their symptoms and the appropriate steps to take, which may include scheduling an appointment, seeking immediate medical attention, going to an urgent care, um, being seen within a certain amount of days in the office, those types of things. But these considerations are crucial for telephone triage nurses or advanced practice providers to provide safe and effective care, especially in the context of telehealth and the increasing demand for the telehealth services. So, some of the barriers to a telephone triage, like I said earlier, these providers, nurses, they can't use their sense of sight, smell, or touch to evaluate the patient or perform a clinical assessment. They must rely on the answers that the callers are giving them, the patients are giving them, to guide their assessment and their advice, and the advice that they provide these patients. So that would, I would say, would be the biggest barrier, is you are um, you're not able to physically see them or touch them. You're just relying on um, your good listening skills and asking the appropriate questions if they're not giving you a lot of answers to go on. So, the last platform or discipline that I'm going to discuss is practicing on call within your practice. It refers to a healthcare professional's duty to be available and ready to respond to medical emergencies outside of regular working hours, such as weekends, nights, holidays. Um, what being on call means is basically one physician or advanced practice provider is available for the nursing staff to talk to during non business hours for a specific amount of time, or also during business hours. If you don't take your own call for your patients during the day. This enables the rest of the practice of providers to rest, as it would not be feasible for a patient's physician to be constantly on call 24/7. So most of the time, if you're in a practice that involves multiple people, whether it be MDs or advanced practice providers, you're going to rotate that call schedule so that you're not on call all the time, and you're not on call every weekend, and you're not on call for all of the major holidays or even minor holidays for that matter. So, practicing on call also refers to the duty to be available. like I said earlier, ready to respond. On-call professionals are typically on a standby duty, ready to handle urgent care questions, calls, just anything that would arise. This responsibility ensures that they can respond to patient emergencies promptly when you're on call. Working on call can be particularly challenging, though, due to the unpredictability of emergencies and the need for quick decision making. You don't know what type of context is going to be um, presented to you when you're on call, depending on if you're in a hospital setting, on call inpatient, or if you're just at home taking after hours call. This practice is essential for maintaining patient safety and ensuring timely medical assistance. So I honestly don't know of many practices anymore, whether it be specialty or just, general family practice, pediatrics, that don't have on-call providers or an after-hours triage service that has the capability to get in touch with those providers that are on call. So they may not be the first line that you get when you call. There may be a nurse doing the telephone triage kind of in between, so that the on-call providers don't necessarily have to be contacted for each call, but they're available for those more emergent, more um, complex situations. Um, Different types of providers take call. Some offices have their RNs take call. Some offices, it's just the MD or just the advanced practice provider or a combination. Um, so and they vary in duration. So sometimes you can do a few days on, a few days off. You could just do 24-hour periods. You could do a whole week at a time, and it's very practice specific on what they do. So barriers to being on call, long shifts of call for periods of days at a time, depending on how your practice decides to do this. There can be some sleep deprivation involved depending on the type of call, length of call. If it's inpatient hospital call, it could be longer shifts. So there's always that component that is involved with call. Work-related fatigue from long shifts of call. If you're practicing all day in the office and then on call all night, overnights, same within the hospital. If you're like a hospitalist provider and you're practicing all day in the hospital and then you're on shift call for multiple days at a time, you can get that work-related fatigue. So trying to find a good balance with that is pretty important when it comes to taking call. And then your on-call work schedules and your mental health. Just trying to find that balance so you don't get that work-related fatigue, you don't get anxiety or depression or the sleep deprivation, any of those things that can come with being on call for long periods of time within your practice. So that concludes my presentation. I do have a few review questions here for you as part of the assignment. So first one is, what are two types of technologies that make up telehealth? Number two, what are two considerations when utilizing telehealth in your practice? Number three, what is a common barrier to practicing via telehealth and telephone triage? And then number four, during a telephone triage, what must you as a provider rely on?